Hello, my name is Kayla Morris, and I'm going to demonstrate venipuncture with a butterfly. First thing I want to do is I'm going to go ahead and sanitize my hands. I've got all my materials already laid out. I've got my sharps box, my gloves, my fake arm, my tourniquet, my tape, my gauze, my alcohol swabs, my butterfly needle with the hub, and my tubes. After I'm done sanitizing my hands, I'm going to introduce myself to the patient, confirm details, and get verbal consent to proceed with the procedure. Hello, my name is Kayla Morris. I'm going to be your medical assistant today. Can I please have your full name and date of birth? Thank you. The doctor wants me to draw some blood from you. Is that okay? Awesome. So, now that I've already sanitized my hands, I've introduced myself to the patient, kind of gave him an idea of what we're about to do. I'm going to put the tourniquet on. I really do not like this arm. Okay. I'm going to ask the patient to make a fist for me so I can palpate for a vein. I'm going to use my index finger and feel for the bounciness and the roundness of the vein. Okay. I've found my site. So the next thing I'm going to do is I'm going to put my gloves on. I'm going to take my alcohol swab and I'm going to clean the area, working from the inside out. Okay. Next thing I'm going to do is I'm going to go ahead, put the tourniquet back on. I can get this thing to stay still. Okay. Oh, that didn't go under. There we go. Okay. I'm going to uncap my butterfly needle. I'm going to ask the patient to make a fist for me again. I'm going to insert the needle with the bevel down. Pull the skin taut and insert the needle. Get the needle in. I'm going to grab my tube and my hub. I'm going to start with the first tube and let that fill up. And since it's been a minute, I'm going to go ahead and undo my tourniquet. Okay. All right. First tube's done. I'm going to invert it. And I'm being really careful not to take my hand off the butterfly. I'm going to go in with my second tube. And I'm going to keep the label faced away from me on both tubes to make sure that I can see the blood. Okay. I'm going to invert it. Okay. Before I remove the butterfly needle, I'm going to take a piece of gauze. And where the needle's at, I'm going to put the gauze over before I pull it out. I'm going to pull it out, put the needle in sharps. I'm going to hold pressure. I'm going to massage it. Okay. Next thing I'm going to do is I'm going to get my tape out. I'm going to secure the gauze in place. Okay. Now sometimes, like before you take blood, you ask if the patient's on any type of blood thinners, like Coumadin or anything like that. You would keep checking it as you know, you document and stuff, making sure that the bleeding slowed down. If the bleeding has not slowed down, that's when you would probably notify a doctor. But that's how you do venipuncture. So the next thing that I'm going to do is I'm going to discard all my materials. On your little tubes, you need to document the patient's name, the patient number, and the date of which you drew the blood. And then, you know, you discard your gloves, put those in biohazard. Sanitize your hands again after you discard your gloves. And that's how you do venipuncture with a butterfly.